Good afternoon. Today on the show we have Dr. WAINE, who is a specialist surgeon at the Port Moresby General Hospital. Thank you so much for joining us today, Dr. WAINE.
Thank you very much to have me again. Yeah, I'm happy.
It's always good to have you back. So today, what are we talking about?
Today, one particular topic that I need to discuss to the general to Papua New Guineans is about healthcare, especially in terms of resources, which includes the buildings, also includes the manpower, both nurses and doctors and all the para health, as in laboratory technicians and all the X-rays and all the fellows. What is the demand there by the sick people?
Yes.
So that's something that I need to just pop up for the interest of the general public.
Okay. Can we take it one step back? Can you tell us what is health infrastructure?
Health infrastructure, like it's any other business of the any business infrastructure, basically will involve the physical infrastructures, like the buildings, and so where the buildings then constitutes the machines. Machines were like X-rays, the lab tests, machines. Plus, if they are operative, in surgery, we have all these other equipments. Plus, some other, like as general equipments in the bed space, beds. Yes. It's all part of the resources. Then the other important thing is the manpower. Manpower will also constitute like on the pyramid scale. The doctors up on the side, up there, plus the nurses. And then we have the paramedicals or the para-health, where the physiotherapists, the health lab technicians, the X-ray technicians, and all other technicians come on board. Plus, talk about cleaners and the securities, in a health center, they're all part of that system.
That's right. Yeah, they're all very important.
Very important.
So, what would you say generally would be the population versus the demand of the need of that health infrastructure?
I was working like more than 10 years ago. I was doing my first year practice as a doctor at Port Moresby General Hospital. And that time, we had only, like example, as 30 bed spaces for labor ward, in the labor ward. So at one time, in one 24-hour day, there'll be more than ladies coming in to deliver, having their babies in Port Moresby, at Port Moresby General Hospital. That's more than 10 years ago. Yeah. So how do we squeeze those more than 30 people or 30 ladies onto a 30 bed space? It's difficult.
Yes.
So oftentimes we see a lot of these ladies squat on the floor, giving birth, or having their laboring process. So oftentimes from that time I realized that the demand is outweighing the resources.
Yes.
Both in terms of the infrastructure, physical, and the human power, human resource.
Yes.
So at that time I know, and that was more than 10 years ago. So now, typical example, if you go to the hospitals like Port Moresby General Hospital, you see there's queues everywhere. Queue to get drugs, to get the pharmacy drugs, queue up to get into seeing the doctor at the clinics, and also to see for X-rays, for blood tests, and queuing up to for emergency. People still queuing up. Some of them on the bed, some are on the floor of the emergency wards at Port Moresby General Hospital, and some are still outside of the reception, waiting to be seen just by a receptionist or an officer, and then going to see a doctor or nurses. So everywhere, typical in Papua New Guinea is a big trouble, big problem.
Yes.
Why? Most of the time they will ask me why. I think on this side is the resources. On that side is population boom. So there is some people that need to really understand these metrics and come up with some good health planners and health managers to manage all these things. Otherwise, you'll see, it's a big problem.
Correct, yes. So would you say that the level of healthcare has improved over the last 10 years?
As in improvement, it's very, it's something that I can say at the same time, take it back again. Because as much as we try to improve, there's so much of diseases there. And those diseases also have changed their behavior of, doing things. As they say, some of them are becoming very resistant to some of the drugs, common drugs available. So diseases are also changing,
Yes.
So either way, the health resources are going up, or the more money put into it. But then you also see the demand in terms of both disease and the disease, like the bugs, they've changed too, becoming very resistant. So it's both of them are climbing at the same time.
Yes. And we also see a lot of voluntary helpers at POMGen. Do you see an improvement there with the waiting time of attending to patients and all that?
We said as much as possible, and then we try to figure out that, but still that doesn't solve any problem at the moment now. Okay. Still, even though we try to get into some IT and put in more machines in that places, but then, as I said, the demand outweigh a lot of these things. So there is this big problem.
Big problem, yes. Before we go, could you mention something to me about the resources coming into the country? Are these being filtered down to the patients that need it?
Well, first of all, we see in terms of the health infrastructures, the levels of care. There is a level 1, level 2, level 3. Level 1 hospital will be like Kerem or further inland.
Yep.
Level 7 will be Port Moresby General Hospital. So some of those bigger hospitals are in between level 5, level 6.
Yes.
Recently, I heard about Kundiao General Hospital. They're trying to increase the theater space, increase the emergency and ICU. They don't have the buildings. They want to do it, and they are going out of their way to raise fund to do these things. So each hospital, there's a demand on the certain requirements. So they realize that they can't wait for the main coffers, main basket. They can't get it from the government, so they have to go out of their way to do innovative things.
Yes.
And that's what they've been doing recently in Kundiao General Hospital.
Wow. We could talk more and more about this later. This is very interesting. Thank you so much for your time, Dr. WAINE.
Thank you very much.
It's a pleasure to have you on the show.
Thank you very much. I'm happy. I'm happy to come in and talk about all these health issues. Thank you very much.
Thanks.